Cheryl Daniels completed her Master's of Nursing in 2018. She has been practicing nursing for 30 years, mostly in a community capacity. Cheryl has been at the MS clinic coming up to 9 years and joined the Movement Disorders Clinic with Dr. Weil in 2015. Cheryl, welcome, and thank you for presenting for us today. I'll pass it over to you now.
Thanks, Alana. First of all, I'd like to address the fact that on the opening slide, it does mention September the 14th. This presentation was originally scheduled for that day. Unfortunately, I became ill that day, so I apologize for the rescheduling, but I'm glad that we were able to get it scheduled fairly quickly. And I would also just like to thank you for inviting me to speak to you today and provide some insight into a common issue that people report with their Parkinson's disease. So just to sort of give you a bit of a roadmap as to where we're going today, we'll start talking specifically first about what brain fog is, give it a bit of a descriptor, how we define or describe it. What we'll talk about is how it is particularly a symptom, and it's not unique to Parkinson's disease, though it is very common, and that there's many other things that can bring on brain fog. So we need to kind of recognize that. And that helps us kind of peel back the onion a bit and find out specifically what the issues contributing to the brain fog is, so that we know how to deal with it. So looking at different strategies to manage it or compensate for that. And as part overall of a description of just general wellness and how we want to continue to maintain good overall brain health to combat that as well. So when I looked up brain fog is a little bit of an elusive symptom, I think. It's very common. People will describe it. In Parkinson's disease, my MS patients also describe brain fog. And so it is really, when I Googled it, it talks about fuzzy thinking or people just not being clear or sharp in their thoughts, not being able to focus, having a lack of focus. And generally when people feel sort of a brain fog, they just don't feel like themselves. They can't think clearly and get things done. Really what we're describing is a symptom. So it's not something, as I said, that Parkinson's has brain fog, MS has brain fog, but it's something that people will experience with these conditions. And again, there's several things that contribute to that. So lifestyle choices, behaviors, different medications that people might take, other medical conditions. And so more specifically, it can be linked to inadequate diet, people having issues with their sleep, if people are sick and have infections, mood disturbances, lack of activity, stress. It's all going to contribute to the inability to think clearly. More specifically, other medical conditions that can directly relate are things like diabetes or thyroid conditions, low iron, heart disease, and of course, maybe carrying some excess weight. When I describe it as a symptom, I think the thing most closely related to that is something called fatigue. So brain fog would really fit into this common symptom of fatigue. And lots of people experience fatigue, but fatigue is very common in Parkinson's disease. Half of people with Parkinson's disease describe fatigue, tired, weakness, and a third of people say that it's the thing that really restricts them the most. So what we're talking about is an sense of feeling exhausted, not having energy to do things. And if people are sleeping well through the night or having naps through the day, they're not always feeling regenerated by that. Fatigue can be described physically, where you're feeling tired, physically not having energy or not being able to carry things out. But the brain fog thing really follows into the mental fatigue. Again, that cloudy, fuzzy thinking where people can't focus and they're finding it difficult to think. So these symptoms as well will overlap with many other things that can be going on in Parkinson's disease, but obviously other contributors of medical conditions or life factors. So we will kind of review some of the reasons that people can experience fatigue in Parkinson's disease and other. And so we will go through these things one at a time, looking at the effects of medication, Parkinson's medication, but other medications, the effects of sleep conditions or issues, altered mood, how that can contribute to brain fog, cognitive issues, overall deconditioning that can be an overall consequence with advanced Parkinson's disease, and then other health issues. So the effects of medication. So some people will describe that they take their levodopa and then all of a sudden they feel very tired. So dopamine medication does have contribute sometimes to people feeling maybe not clear or fuzzy in their thoughts. But really with levodopa, it's more, I think, the effect of the on-off phenomena. So this, I like this graph that sort of shows how the medication cycles work in Parkinson's disease. And you can see in the mild stage of the disease, people will have a good overall coverage and effect from their medication. But as the disease progresses and you get into the moderate or severe stages of the disease, people aren't getting the same benefit of their medication, and they're spending more time in the off phase or in the overtreatment phase. And so sometimes with levodopa, when people are adequately treated, they feel quite well. But when they're going into the off phase, on the downswing of the cycle, and they haven't quite yet come on, it will be this period of time when people might not feel overly energetic or feel quite tired and fuzzy thinking. So we do have advanced therapies of deep brain stimulation or do-a-dopa. And these therapies help to kind of saw off those really severe peaks and valleys. And so the therapy, deep brain stimulation, works differently because it's not really a medication, it's a direct stimulation to the nerves in the brain that helps to do that. Do-a-dopa really is just levodopa, carbidopa. It's just delivered in a different fashion. And so we're able to kind of dial in a little bit more precisely with it. And so as a result, it takes off those severe peaks and valleys. And so it just kind of cuts down on that off time. So that's really what we would be getting with these more advanced therapies. Dopamine agonists are a different type of medication that we use to treat Parkinson's disease. These therapies are known to cause sleep attacks and unexpected. So though not very common, they can occur, and they don't necessarily occur just at the beginning of therapy. You may be on a dopamine agonist for a period of time and then experience this type of phenomena. But more likely, dopamine agonists are well recognized to cause compulsive behaviors. So it could be overdoing any particular activity, overspending, gambling, things like that. So particularly depending on the type of activity that these medications can create, it may contribute to overdoing things, exhaustion, and can contribute to brain fog. The other more positive thing about dopamine agonists is that sometimes they stimulate areas of the brain that trigger or reinforce positive, delightful or enjoyable activities. And so that's why we get the compulsive behavior. But the other side to that is it can create some antidepressive properties. So sometimes if people are experiencing some apathy or depression with their Parkinson's disease, but their motor symptoms are also not well maintained, then if we introduce a bit of a dopamine agonist, then it can actually improve that. And so as a result, it can improve some of the brain fog or the sluggish thoughts as well. So it's kind of interesting how it can actually act on both sides of the issue. Amantadine is a medication that we use to treat people with Parkinson's disease. We use it mainly to help to control dyskinesias that people can experience with overtreatment. And it can create some benefits with mobility and balance. And the spin-off effect with amantadine is that it's a stimulant. So again, if people are experiencing fatigue, both physical or mental, it can, again, provide some energy and clear that fuzzy thinking. If people, a common symptom with Parkinson's disease can be depression, anxiety, or apathy. And so it is well known that people who do experience these emotional or mental health conditions will often feel tired, fatigued, not think clearly. And so simply by treating those conditions, giving the antidepressant, lightening the mood, or treating anxiety and slowing down the excessive thoughts, again, that can bring some clarity to thought. We have to kind of examine other medications people might be taking for other reasons. Are they taking sedatives to help them sleep? And are these providing kind of a hangover effect? People who treat pain phenomena, sometimes these medications can be quite sedating. Beta blockers for heart conditions or using them to manage tremor can create some difficulty with feeling overly fatigued. So we always have to look at the overall medication schedule to see how things can maybe working for or against each other, and make some adjustments or changes, making medication changes, scheduling different timing, things like that. So medication reviews can be very helpful in this regard with a family doctor, with a pharmacist, etc. Usually we want to try to simplify medication schedules overall instead of making them more complicated. But keeping that in mind, because sometimes things just continually get added and aren't sort of re-examined as is this medication still necessary? So the second topic, sleep issues. Sleep issues are very common in Parkinson's disease. And people can have pre-existing sleep issues. And some sleep issues can actually precede the diagnosis of Parkinson's disease and the physical symptoms that we see leading to diagnosis. And sometimes that can happen several years, even up to a decade prior. And particularly that would be REM sleep behavior disorder. This is a condition where people with Parkinson's disease, when they are sleeping, they're acting out their dream, they're kicking, they're punching, they're calling out in their sleep, where normally when people are in REM sleep, the body is paralyzed. And that's a phenomenon that occurs with Parkinson's disease. Now, this particular condition doesn't really impact the sleep of the individual with Parkinson's disease. So this does not contribute to lack of sleep and therefore mental fatigue the next day. But it probably more affects the bed partner or the care provider in that respect. More commonly with Parkinson's disease, people will experience difficulty falling asleep initially. In lack of that, people can usually fall asleep pretty well because by the evening, they're usually quite exhausted. So they'll fall asleep quite quickly, but then after a short period of time, they'll wake up. And that may be an hour and a half, 2 hours after. At this point in time, they have a hard time getting back to sleep. So people will experience insomnia, and this can go on for hours in a night. And night after night, of course, that can build up and cause a lot of fatigue. So commonly what can happen as well, I hear reports of the care partner again complaining about their the person with Parkinson's disease sleeping too much. So the other side of that is that the individual does sleep. They are quite fatigued. They go to bed early in the evening. They sleep all night long. Maybe it's broken up with trips to the bathroom or things like that, but they do sleep several hours through the night. And then they get up in the morning, have their breakfast, have their medication, they sit down in front of the TV or what have you, and they're dozing off to sleep. So frequently through the day, if they're not overly active or doing things or stimulated, then they'll tend to doze off to sleep. These types of situations tend to occur in more advanced stages of the disease. And then you can have people with other cognitive symptoms that contribute to disruption of sleep overnight. When people get quite agitated, they're sundowning, so they start to get confused at night. They might be up and wandering around, hallucinating, and not that these can't occur during the day as well, but certainly is not conducive to the individual settling down to sleep at night. And of course, it keeps the care partner awake at night. So what we do know is that the effects of Parkinson's disease and the degenerative damage that it does to the brain changes how the brain is able to regulate sleep. So this just picture shows how the normal cycle would go through the day with wakeful periods, and then how our body gets ready to prepare for sleep in the evening, and how that should go through the day. And then towards the morning, then our bodies are changing again to help us to start waking up. And this is all broken up in Parkinson's disease, and it leads to fragmented sleep overall as a result of the disease. Now, also, Parkinson's disease tends to be more common in older adults. So the majority of cases are diagnosed after 60. And with each decade, the frequency or the incidence will increase. And so normal aging will also contribute to a breakdown of this normal sleep-wake pattern and the circadian rhythms through the night. And with age, we will tend to get more fragmentation of sleep. People, as they age, will spend more time awake during the night than younger counterparts. And there are less, I guess the length of time that would be spent in deep sleep and reparative sleep and the REM sleep are shorter and more broken up. So we get the disrupted sleep, but of course that leads to sleepiness and fatigue during the day that gives us that sensation of not being able to think clearly and reduce mental clarity. Other things with Parkinson's disease that disrupt people's getting a good night's sleep are the return of their Parkinson's symptoms, so a wearing off phenomena of their medication. They may find it difficult to get in and out of bed or to reposition in bed. And so they can be uncomfortable, but it's difficult. So it's quite an undertaking to get turned over or repositioned. And through the course of that, then it fully wakes somebody up and it's hard for them to go back to sleep. Other symptoms that people experience with wearing off, they'll get a return of their tremor, and that can wake them up at night. The rigidity and restlessness can be, again, part of their difficulty moving in bed, or getting dystonias, painful muscle contractions that, again, are very uncomfortable and can wake them up. Other wearing off symptoms are thermoregulatory symptoms. These are part of the autonomic dysregulation, non-motor return of symptoms that show wearing off. And people will say that they get very hot and sweaty, and their bedclothes will be all wet. Their bedding is all wet and soaked, and it's very uncomfortable. But of course, if they get up and change, then again, they're fully awake. And sometimes dysregulated moods. People will get overactive bladder sensation. They can have it during the day. They can have it at night. Sometimes they're fine during the day, but that whole phenomena kicks in when they lay down and go to bed at night. So they're having to get up 3 and 4 and 5 times a night. And of course, once you go to the bathroom and get back, get into bed, you're fully awake. Many people have undiagnosed sleep apnea, and sleep apnea tends to be more common in the Parkinson's population, not limited to that. But if people have sleep apnea, of course, it prevents them from getting into deep sleep, and their sleep is disrupted several times a night. So, of course, with that, then you're going to feel sleepy and tired and less clear thinking during the day. So if we can have a sleep assessment and determine that that is something that we can treat, then often that can improve people's sleep. And everybody experiences stress to some degree, and this is a fluctuating thing. How well do we cope with and manage our stress can certainly contribute to sleep disruption. So what do we do about that? Many people look for medications to help improve their sleep overall. So we do know that people with Parkinson's disease don't secrete as much melatonin as the general population or people without Parkinson's disease. And melatonin is something that does promote sleep. If you maybe didn't pick it up on that chart, but it starts to, the increase of secretion is in the evening hours, starting around 9 or 10 at night, and it increases through the night and then starts to turn off towards the morning time so that we become more wakeful. And so this may be a contributing factor a little bit to the development of the REM sleep disorder behavior. So often if people are experiencing that, we will recommend that they take melatonin, and it may help and it may not help. Or people find that they just feel a bit fuzzy or get a bit of a hangover effect from the melatonin. So sometimes that's not overly helpful, but it is a simple thing to try. Clonazepam would be a prescription medication that we can give that can help manage that REM sleep behavior disorder. And of course, if people's sleep is interrupted because of things like depression and things like that, sometimes we can improve their sleep experience with some antidepressant medication. One of those would be mirtazapine that often we don't necessarily, it may or may not be to treat depression itself, although it does have antidepressant properties and it can have some sedating effects to help people sleep, and it can also help tremors. So sometimes we can have multi-use agents like that to facilitate sleep and other issues. Of course, if your Parkinson's symptoms aren't well managed throughout the night, then we have to have a look at that and see how do we make headways of that overnight, improve overall Parkinson's symptoms throughout the night, and then keep people on so that it isn't that's disrupting their sleep. Good sleep hygiene is something that can be important for everyone. This is things like maintaining a regular sleep routine, not doing overly exertional activities in the evening time, trying to wind down and be quiet at night, have a regular time that you slow down and get ready for bed. Consider your sleep environment. So, you know, is the temperature okay? It's not too hot or too cold. Is it dark? And then avoiding stimulating activities. This can even be things like screen time. So being on the phone or tablet, even TV, which can be difficult. Many people do use that in the evening time, but maybe shutting off the TV a bit before sleep, maybe doing some reading or something like that, or some meditation to sort of calm yourself down, and preparing that way. Sometimes, in addition to medically treating Parkinson's symptoms, some people do find using things like satin sheets or satin pajamas as a way to facilitate moving in the bed at night, even using a bed rail to help you turn over. Looking at overall behaviors through the day that can contribute to sleep. So regular exercise to sort of promote more fatigue throughout the day, getting adequate exposure to sunlight during the day that can help us fall asleep. Avoiding, if you are tired and you do need to nap, not taking long naps or later in the day, and having regular stimulation during the day to keep you focused and active during the day. And then, of course, addressing any stress that you experience and finding adequate ways to manage your stress. So I've already kind of alluded to the fact that many people with Parkinson's disease do experience issues with mood. They can be experiencing depression or anxiety, or more commonly and later on in the disease, apathy, where you're just not really interested or caring about things that you used to care about. But depression is, feeling tired and fatigued, not enjoying the things you used to. Anxiety would be a constant worry. These types of things can exist prior to their diagnosis, but certainly are part of the effects of Parkinson's disease and the effects of the brain over time. And you can see that it's very common. 30 to 60% of people can experience mood effects. Anxiety tends to be something that occurs as well as a wearing off phenomena. So people, when they're starting to wear off their Parkinson's medication, sometimes instead of seeing tremor, having movement issues, they'll start to feel anxious. And so recognizing that occurring as an early wearing off symptom. These mood changes can occur anytime during the course of the disease and may be one of the first symptoms that people experience. Of course, getting a diagnosis of Parkinson's disease, and dealing with the changes over time and just coping overall with what that brings can contribute to depression or anxiety. And as I mentioned, really the anxiety tends to be more of a wearing off phenomena, or can be, as I should say. So if we can lighten mood, often we can bring some mental clarity. So again, we have to consider how we're going to maximize our Parkinson's symptoms, and specifically, sometimes that is all we need to help mood, but if not, then maybe we need to more specifically treat mood issues with antidepressants, etc. Often we might make referrals for counseling or some psychiatry to help with mood issues and or cognitive challenges that can occur. So if we think that will be helpful, we will point you in those directions. Using more strategies like meditation, biofeedback, yoga, cognitive behavioral therapy that are known to successfully manage mood disorders. Also getting people active and continuing to participate in society. So being able to participate in social activities, getting some adequate support from support groups, things like that, volunteering. So feeling like you're contributing and participating in society obviously makes people feel better over time. And again, we come back to the overall being active boosts mood, helps your function overall, exposure to sunlight and fresh air, and of course, healthy eating is going to contribute to overall sense of feeling of well-being. One of the main common causes of not feeling cognitively clear or not feeling like you are as sharp as you used to be are altered mood. And so this is one of the major things that we can do to make sure that people do think and feel much more clear, is treating their mood. So cognitive changes occur in Parkinson's disease. And so people will feel their memory isn't as sharp. It's hard to maintain attention, and maybe just a general slowing. So although everything still works, it can be difficult for people to keep up, say, in a conversation, if people are, the conversation's moving along very quickly. And cognitive changes tend to occur naturally as we age. People will recognize that maybe I'm not as sharp as I used to be. And particularly the longer that you experience the disease. So it tends to be the mid or later stages of the disease that cognitive issues can become more apparent. So they can present as more memory or thinking issues, like more of the dementia, or it can contribute or present more like hallucinations and delusions and things like that. Again, these types of things can occur with the medication on-off cycle. And cognitive changes can be exacerbated by some of the treatments. So it can be driven by the disease itself, but it can also be part of the effects of medications. And so some of the Parkinson's medications are more likely to contribute to issues with hallucinations and delusions, but it can be as a result of levodopa itself. So we would start by looking at what medications an individual is on and maybe need to start to cut back on some of them, and even the levodopa. But because, again, Parkinson's disease is more prevalent in older individuals, and these people can have other comorbidities or other health issues going on at the same time, there may be a combination of why people are experiencing these cognitive changes. And so, again, cognitively and mood issues affect how well your brain is working and how clearly you can think and remember things. And so it can be things like overall head injuries that may have been from earlier ages or even prior to the diagnosis of Parkinson's disease, but things like vascular damage and stroke can alter cognitive function. So again, just recognizing that the majority of people are over 65, again, as we age, people start to experience more memory loss. And then again, increasing with age, and how people with Parkinson's disease are generally older. But the way that people with Parkinson's disease sort of demonstrate or might experience cognitive function changes over time is very unique and individual. And so it's no one size fits all, but it does vary for each individual. And again, we have to kind of look at that individual and see what else, particularly for them, might be contributing to that. Even though these types of things are common in as we age and with Parkinson's disease, when we're really looking at it being an issue is when it interferes with your ability to function day to day. And so you're no longer, it takes away your independence, and it's concerning to other people around you. So generally people will recognize, hey, I'm not functioning as well as I used to, but it's more of a concern for the individual themselves. It's usually not a problem. When it becomes more of a problem is when that individual no longer recognizes it as a problem, but other people around you do. So in general, when I'm talking to people, I say, well, how do your concerns that you express, do you find that the people that you interact with and you know, in your peer group, are they doing the same thing? And so does it seem to align with that? Or is it out of usual concern? So again, is it concerning for the caregiver? And then another big component to that is safety. Are you doing things that are putting yourself at risk or others at risk? And that usually is quite a flag for cognitive changes and again, contributing to not clear thinking. So dealing with cognitive issues, again, we need to adequately try to manage our Parkinson's symptoms, either with Parkinson medications or other things like sleep and mood issues or other things that are disrupting our clear thought patterns. There are specific medications that we can provide to specifically address the cognitive issues, rivastigmine or donepezil. So sometimes those medications can help take away the hallucinations, for example, and give us more wiggle room to help adequately manage your Parkinson's symptoms with Parkinson medications. So again, making those adjustments with those medications. We want to always encourage people to continue to not only exercise their body, but keep their brain active by participating in doing different activities, reading, doing puzzles, you know, doing different things where they're active and needing to use their brain so that, you know, you keep cognitively sharp. considering when you're in your best time. So not a time of your day that you recognize as a low period where you're not thinking clearly, you're more tired overall. A time when you're more rested or your medications are working properly, and timing important activities or the things that you do strategically that way. Practical strategies of managing cognitive issues are the things identified in that picture. So obviously, if memory is an issue, you write things down. You have sticky notes. You use alarms on your phone. You have to maybe pull in the troops of your support people around you to provide reminders and things like that. And caregiver support. When we're dealing with cognitive issues in an individual with Parkinson's disease, it becomes very much more burdensome on the caregiver. And so it can contribute maybe lack of clarity in the individual with Parkinson's, but as well the caregiver with the added stress and the disrupted sleep and things like that. So often we're needing, that is when we're dealing with cognitive issues, it's a burden on the caregiver as well. So they can be experiencing brain fog and fuzzy mental status. Parkinson's disease over time becomes very difficult to manage, and everything gets to be more difficult to do. So difficulty with movements and getting things done, it's slower, there's lack of energy. And so over time, it gets to be harder and harder for the individual as well as the caregiver, spending more and more time managing the disease, that you're able to do less and less. Strap on some apathy where people aren't really motivated or feeling up to doing activity, and overall stress that levels, increased stress levels on the caregiver, on the individual. So when we do less, there's overall deconditioning. Deconditioning and doing less, getting less stimulation, less activity, doesn't circulate the blood as well. We don't get good oxygenation and blood flow to the brain. Less stimulation, so you're kind of just sitting there with not doing as many activities, isn't conducive to overall good cognitive function. So, and this is inevitable, and it is difficult for people over time, but small bits of headway into these areas can make big differences. So exercise, it's difficult to get out to exercise. Or it's physically difficult to exercise, but even chair exercises or different stretching and movement can facilitate some of this this more cognitive function, participating in different activities, and that can be even as simple as just household or day-to-day activities around the home, as well as out if you can get out, bringing people in to stimulate interaction with other people, and maybe needing some help over time to focus on help with certain things so that you can focus on other things that you need to do, activity, exercise, to facilitate this effect. So again, other health conditions we addressed that people might experience that can contribute to fatigue, physical and mental brain fog or fatigue. So again, the whole idea of age, people experiencing other medical conditions, looking at the medications that you're taking that might contribute side effects and cause less cognitive clarity. People with Parkinson's disease, again, can experience orthostatic hypotension. So when they go to move, they have like severe drops in blood pressure to the point that they feel dizzy, woozy. They're not getting the blood flow to the brain. So without that, you can't be very bright and sharp. Chronic pain, some people will experience pain. And with pain, it can be very exhausting. As well as the medications you use to maybe manage that pain. And again, we've already talked about sleep apnea and how that can be a simple way to treat that and then facilitate maybe some more clear cognitive symptoms. So again, we have to manage these underlying medical conditions, maintain a healthy blood pressure, keep a healthy blood sugar range. Again, consider medication review. We've talked about that, where you might alter medications or timing, exercise, healthy eating, and drinking water. We tend to, as we age, drink less water, but our bodies are made up significantly of water. Over 50% of our bodies are made up of water, and water is necessary for all the functions of our body to work properly. As we age, we tend not to get that signal that we're thirsty. We don't drink as much because we don't get stimulated to do that. People with Parkinson's may have bladder issues, so they may not want to overdrink, so that they don't think that they maybe make that symptom worse. But simply drinking water can make a big difference as well. We talked about brain wellness, so otherwise taking care of our brain, so that we do have a condition with Parkinson's disease that affects our brain and causes damage and degeneration. And so we want to minimize the effects of other things that might do the same. So maintaining a good blood pressure so that we don't have ischemic changes in our brains. Be smoke-free, which we know can cause changes in our brain health as well. Alcohol in moderation. Again, repetitive things that we hear overall as far as healthy living, but adequate healthy eating, so that we have the proper nutrients to feed our brain. Adequate rest. Again, that can be a challenge, as we've already discussed with Parkinson's disease, with the many challenges that can disrupt our sleep. Sometimes just being more organized helps with memory, and having a regular schedule and routine can make things work a little bit more smoothly. Planning ahead and being more organized, that all goes together. And doing the best you can, and knowing that it doesn't always work well. Parkinson's disease people do realize many times that, there are good days, things are working well. There are bad days where it doesn't matter what you do, nothing's working well. And so there isn't really a way around that. That generally is what happens over time. And just kind of giving up on those days that things aren't working well, and planning for the next day, or maybe a few hours pass that are particularly bad, and then considering being more productive or successful after that. So overall, in summary, brain fog is something that many people with Parkinson's disease talk about. That it's not as simple as here's your brain fog pill and it'll take it away, but there's many things to consider that may be related to Parkinson's but may not be, that may be part of why you're feeling this lack of clarity in your thinking. But we also have reviewed that there could be very many specific medical and lots of practical things outside of just Parkinson's disease that people can maybe consider to help alleviate that to some degree. And recognizing how, like most symptoms in Parkinson's disease, people, when they talk about issues that they're having, maybe don't contribute that to where am I in my medication cycle. So we're always bringing people back to, when is this occurring during the day? And is it happening in and around maybe when you're wearing off, or when you have taken your medication, but it is not yet kicked in? And many times that's the case. Sometimes it does occur just randomly. And again, those types of sort of very all of a sudden, where things are very unpredictable and occur at any time, will tend to be something that happens with more advanced phases of the disease, where your treatment is not as predictable. And as we've seen several times throughout the presentation, and most people with Parkinson's disease already know, that exercise is a very critical part to living with Parkinson's disease, to maintaining health. It slows the progression of the disease, but of course it has many other spin-off benefits. for managing many of the other symptoms of Parkinson's disease. And so that brings me to the conclusion of the presentation. And I do see that there are some questions in the chat box that I will go ahead and address. And then if there's anything else, we'll go from there. So one question back to sleep is, do sleep issues occur once someone is taking Parkinson medication? And again, not necessarily. So with any symptom with Parkinson's disease, people may have it or they don't have it, or they have it severely, or it's a little bit of a problem. So it's not necessarily the medication that is the issue, it's more the disease, or it is more other factors. And so if somebody did not have sleep issues and they take Parkinson medication, that won't automatically contribute to that. But living longer over time with Parkinson's disease, somebody may develop sleep issues. But it's not necessarily related to the medication. So I hope that answers that particular question. And if not, please provide some more feedback in the chat. Melatonin timing and dose range. Again, this is very individual. The timing would be in the evening. So it would be more as you're getting ready for bed, maybe with your bedtime medications, or even to precede bedtime by an hour or so. Again, not everyone, melatonin doesn't work for everyone. And the amount of medication, people will respond to different dosages. So, but you can get it at different dose ranges, 3 milligrams, 6 milligrams, 10 milligrams. Some people will find 3 milligrams is enough for them. Some people might find that even on taking that, it may help, but they don't feel clear the next day, so they won't continue to take it. Some people will take up to 10 milligrams and it works well for them, or people won't find really any benefit from that. So it, like most things, it can be a bit of a dose finding experience, finding what helps you, what can be helpful, but doesn't give side effects. And we usually always aim for the least amount that you need to get benefit. And that would be something with melatonin, as we do with all of our Parkinson's medications. We always want to minimize the amount that you need for effect. Question for John: would cognitive mental activities, exercises help maintain or even improve one's abilities? And yes, I think that's the case. You know, the whole adage of use it or lose it. It doesn't mean that it would prevent maybe developing some of the complications over time, but it certainly will help to keep one functioning as highly as they can for as long as they can. And again, you know, it's just like physical activity, like cognitive or brain activity is just important to keep one functioning as highly as they can for as long as they can. So my husband takes mirtazapine, which was prescribed to improve his gait. Positive side effect, and yes, it can do that. Of course, it is an antidepressant. Negative side effects is how it causes drowsiness. My husband's constantly nodding off. Are the benefits of mirtazapine better than the bad effects? So there's more to the question, but I'll stop there. You know, that's always a very individual thing. And because some people may only get benefit, some people will only have side effect with no benefit. And in that situation, there's no use continuing on with it. If there is some benefit and some downside, perhaps it could be a dose issue. Whether you can cut the dose back a bit and still get benefit and not the side effect. And of course that may work, it may not. And then is it the mirtazapine causing the drowsiness? Or is it something else? So that may need to be kind of explored a little bit. Is there something better as an antidepressant that won't cause drowsiness? So I think that it depends on what you're treating. So as you said, it was prescribed for gait. Its spin-off benefits is as an antidepressant. So you'd have to ask yourself, are you actually, what's your target for treatment with the mirtazapine? Is it mood, or is it simply something else? Is it to help with sleep, and is it to help with gait, for example? So if you're looking for antidepressant benefits, and anytime if you're not getting sort of what you're trying to achieve with your medication, then you can consider, is there an alternative agent for that? And you might just have to try it on for size. How much does it affect the gait? It seemed to work very well for this. So, you know, sometimes things work initially and then they don't work. And so sometimes people will kind of cast them off and say, well, we gave that a try and it worked for a while and then it didn't. But that doesn't mean we won't sometimes come back to use that again, because we can try different things, but sometimes we run out of options and then we have to start recycling things as well. So again, you know, how much it can affect that is really individual, and you have to try. And then there can be different dose ranges that people might consider trying. So very common, they take, I'm trying to remember, like 15 milligrams at nighttime. Sometimes people will go up to 30, but people have tried even 7.5. So playing around with the dose a little bit, finding out if you're getting benefit. If it's no longer working, sometimes people will try without, and sometimes that's a good way to determine what benefit somebody was getting. So they might think it's not really working, but when they take it out, they find things a lot worse, and so you might put it back in. All right, there are no further questions in the chat box. If there are any other questions, I would be willing to address them. And if not, I think we are perhaps finished.
Well, thank you so much, Cheryl. That was very informative. And thank you all for attending. And Cheryl does have her email at the top. And I guess it's okay to contact you if they have further questions, Cheryl?
You bet.
Okay, great. So thank you so much. And like I said, the webinar is recorded, so it should be available on the website. Have a great afternoon, everyone.
Thank you.